Hello viewers, welcome to another exciting episode of Dr. ABC Show. My name is Dr. ABC. I am a physiologist, and today we are going to have another exciting program to learn about the factors that affect our health. Today I have a very wonderful and experienced doctor in the studio who is going to take us through the education. Last week we learned about few things about our age, how our age affects our health, how our gender or our sex affects our health, and how our name also affects our health. Today we are going to continue from there, and we are going to look at where you stay, your contact number, your contact address. Many a time people go to the hospital, they ask them what's your house address or your residential address. They have to guess and get something to be written down. They ask, who is your next of kin? I mean, they really don't even know who their next of kin is. They just find some name and some number to give. Today we are going to ask our guests to explain to us, does that have any implication on our health? So I have here in the studio Dr. Emmanuel Chegan. Dr. Emmanuel Chegan is the medical doctor in charge of the medical school clinic. Reverend Dr. Emmanuel Chegan, you are most welcome to this exciting show.
Thank you for the privilege.
Okay, so like we did in the last episode, today we want to progress from there. Your contact number, does it have anything to do with your health?
I'll start this way. The name, the age, and then the sex information we get right from the beginning. Those ones don't change. This next set of information also don't change.
Okay.
So your birthplace, your contact address, your next of kin, your race, your tribe, your religious inclination, all of them are critical for how you are managed, because now medicine is moving to what we call social cultural dimension of health. Okay. Before it was the biomedical.
Okay.
So now it's bio, social, psycho, cultural aspects, because we now realize that medicine or health is affected even to some extent more by all those social, cultural, and religious issues than even the physical issues.
Great. So let's pick it one after the other. Your contact number.
Yes.
What role does it play in the health of a patient?
So now, 2 people have been identified with the coronavirus positive in Ghana.
Okay.
We want to do contact tracing.
Okay.
What is the environment that he lived in? They've been in the country for about a week now. So it means he lived in a certain home. He lived in a certain environment.
So we are talking about the contact number, my phone number.
No, yes, your contact number, but beyond that, your residential address is critical.
Okay.
Because if in case of emergency, you may have to look for somebody. In case you need somebody from the house, you're in the hospital, you want the staff or somebody to go there, it's very critical. Then the environment also will tell us, because there's a certain environment. We saw the people at one 2 days ago complaining they live in an environment where they have the rubbish, the landfill, and maybe there are certain diseases associated with that environment. So when we know he's staying at one near the landfill, he comes to the hospital, he's suffering for certain things. If I know those issues, I may link it up with those issues.
Okay, so before I go to the clinic, I should be sure that I know my house number,
yes,
my contact address.
Yes.
Okay, so I shouldn't just impress the doctor by telling him that I live in such and such a place, when in effect I live in a different place.
Yes. And the more important thing, most will just come, why do you say Agege? What's your street number? And we've named street number for years now. Most of us don't know. The GPS now, most of us don't know. So this is to let us know that things are not done by government for nothing. They're actually done for our good.
So sometimes people may think that you want to know where I stay so that you think I'm rich or I'm poor. That is not true.
Yes, that's why I mentioned the social. Because the social also determines.
Okay.
What kind of food do you eat? What kind of later on we see that work is also important. How kind of work do you do?
Okay.
And all those things are all important factors that also affect your health. And then we can also determine what kind of, sometimes it determines what kind of services you can afford, may not afford. And then not because we will not give you the service, but then the system can also see how can we help these people, how can we not help these people.
So meaning, if I come and I give a very wrong residential address and there is an emergency and you want to trace or you want to give an information, there is no way you can trace me.
No.
Okay. So before I come to the clinic or before I come to the hospital, I should be able to have my residential address with me.
And then your phone number. And
okay.
Any other number.
Okay.
The next of kin is critically also important. Why somebody has to.
That's where I was going to come to. Yeah. So the next of kin
for certain decisions to be taken.
Yeah. So normally you come to the clinic and before they ask who's your next of kin, they have to find one immediately and put there and find some name to put there. What effect does it have on my health?
Yes. So who's your next of kin? Later on we'll go into what family history. It's also very important. So the next of kin can be available to help. Now that we are doing health insurance is only taking at a certain level, but at a higher level, then the next of kin can come in. Next of kin can come in if you are minor, and certain decisions have to be taken concerning certain management or treatment or surgery. Then they have to bring in the next of kin.
Okay.
In case of emergency or certain decisions have to be taken, the next of kin or somebody close to you will have to be brought in. If unfortunately you may need to be transferred to another place, somebody have to know that you are being transferred. Or if there's unfortunately there's a death in the night, then somebody needs to be contacted. So all of those things are critical as part of your health. And then your area, as I said, also determines. The environment also determines certain diseases, certain things you are exposed to, certain culture, certain attitudes, certain behaviors. All of those things are important for us.
Okay, so if I come and I just guess and I give any name at all, what will happen is that there may be a time that you need to contact somebody important to take decision and the person may not be there for me.
Yes.
Okay, so I should be able to get a next of kin before I come to the hospital. Okay.
Green Hills Stroke Rehabilitation Center is a rehab center located in Sakaman in Accra, Ghana. It is the first accredited stroke rehabilitation facility established in Ghana. Green Hills Stroke Rehabilitation Center seeks to provide a high-quality rehabilitation service to stroke survivors who are out of the intensive care and requiring rehabilitation to restore functional performance of activities of daily living. The rehabilitation team includes attending physician, neurologist, rehabilitation nurse, 24-hour service, physiotherapist, occupational therapist, speech and language therapist, dietitian, clinical psychologist. Aside the stroke treatment, we treat other diseases at the Green Hills Medical Center. Call Green Hills Stroke Rehabilitation Center now on 055-2505-108 or 030-3974-818.
So what happens if I'm not able to provide a nurse of kin at all?
Oh no, it just means that the system wouldn't have to provide those services in the absence of that. Okay. So generally there may be a delay.
Okay.
Certain decisions may not be taken, certain surgeries may not be done because legally certain authorization has to be done. If it's not a life-threatening point, then we have to delay before and ask certain people to come. So, and then, like I said, also your environment also predisposes you to certain diseases. So, if I stay in an area where there's a lot of galamsey, which happened to somebody I know, and the person was admitted at a certain hospital, he couldn't breathe.
Oh, okay.
When they take the oxygen off, he couldn't breathe. So then we realized that it was around some place in the western region was exposed to galamsey, and the lungs were destroyed. So he made a lot of money, but for the 3 months that he was in the hospital, he spent virtually his money on the oxygen.
Oh, okay.
So knowing even where you lived, where you stayed, for how long you stayed there, like now the corona also certain countries are barring airline flow, certain environments are being quarantined. So all of those things are critical to determine of your exposure, your isolation, your medication, your ability to pay. All of those things are critical.
Oh, okay. So what it will mean is that where you stay can determine the kind of ailment you may suffer, that you may be predisposed to. Yes. Okay, but then the patient cannot do anything about it. Yeah. Okay. Or maybe you ask the patient to take some precautionary measure to avoid the particular diseases. So if I should tell you the wrong one, you may not be encouraged to give me that advice because, okay.
Like I said also, preventatively, if you are exposed because of your environment, then the public health people can also follow up.
Oh, okay.
And then, like we say, monitor and follow up on those who in your environment also have been exposed to the same situation. And also, sometimes also determines the kind of language you speak, because the language also, communication is very important.
Okay.
So sometimes people come, they are not able to speak. You need to know somebody who can interpret for them, somebody who can do that. Sometimes the environment also determines the culture and the religion of the people. So one question leads to another, because it's certain diseases are supposed, certain tribes, certain races are more prone to certain diseases. Sickle cell, as you know, you are doing some work on that. It's more common in the people of African descent or black descent generally. Another one, thalassemia, is around the Mediterranean region. So your place of birth, your place of stay, all of those things. If there's a cholera outbreak, your place of stay become very important.
Okay.
So if you stay in that area, there's a cholera outbreak, and you come and you stay in this area, then the public health people can move in that area and continue in that area. So when we were having the cholera, that was what was happening. So all those questions are very critical and important.
So it helps you to know to trace the source of a disease.
Yes.
So maybe in a day, about 10 people have visited your clinic with cholera from this area. Then the public health people will move in.
Can be alerted straight away.
Oh, okay.
Or disease control people can be alerted.
To go and contain the disease.
Yes.
Containing the disease means that you keep the disease
in that environment
that it doesn't spread. Okay. And so given where you stay can help us.
Yes.
Oh, okay.
Or you have a certain disease called food poisoning. You know, the food is eaten contaminated. You can know that, you can find out, are there other people in your environment at home who are also suffering? Some may not have come to the hospital. You may have been able to come. So we can then do that.
So what it means is that even telling us where you stay is not helpful to only you, but even to the society.
Yes, your family.
Your family and everybody. Yes. If there's any preventive measure, it will be done. Then maybe you are not the only person that we can trace. Okay, I think that's very, very enlightening enough. Yes, and so having said that, then maybe the place of work is also very important. How does it affect our health?
I've already alluded to that.
Yes.
Why somebody was doing that, say, for about 15 years, but then didn't know that he was exposed to dust.
Okay,
which destroyed his lung. Place of work, again using the corona. A lot of a coach of a team in England has just been affected, and a player in the USA was affected yesterday. So all the people in contact had to be isolated, and their matches have to be postponed. Your place of work has issues related to food you eat, your ability to exercise, your ability, what kind of food you eat. It had to do with stress, because a lot of people are having stress now. It deals with the kind of people you interact with. It deals with what attitudes and behaviors. So work itself is extremely critical. And I have an example of somebody who we saw some years ago who was weak and paralyzed in the leg. It was only when we asked about his work, he said he was a farmer, and we knew he was using pesticides. Then we realized that he had pesticide poisoning. Then directed us to what type of pesticide. So is there an antidote to the pesticide? And then we could help it. But otherwise, we were thinking that it was just a Fienipa and all those things. Until we realized that some Christians say it was a devil, it was juju. We just realized that it was because he was using certain pesticides in the work environment.
Oh, okay. So that should also dovetail into the type of work you are doing.
Extremely important.
So the place of work is one arm, and the type of work will also be another arm. How does that one also affect our health, the type of work?
So those who do oil rig, they go there for a certain time and come back because it's a stressful environment. They are away from home, they are away from family because family is also important.
Okay.
To determine your health. And like I said, they are stressed. Like I said, they leave 4 in the morning, come out late at night. So their home, which they think they own, is actually they just come and sleep for 4 hours and then go to work and work for somebody. Meanwhile, they don't stay at home. So all those things, the work is extremely. But there are too many people who have based success upon what they do at work, forgetting that it's health. Okay. And so most of the diseases we have, that's what we call social diseases. All of this hypertension, diabetes are all related to lifestyle.
Okay.
Lifestyle diseases. They are not like their lifestyle diseases.
Green Hills Stroke Rehabilitation Center is a rehab center located in Sakaman in Accra, Ghana. It is the first accredited stroke rehabilitation facility established in Ghana. Green Hills Stroke Rehabilitation Center seeks to provide a high-quality rehabilitation service to stroke survivors who are out of the intensive care and requiring rehabilitation to restore functional performance of activities of daily living. The rehabilitation team includes attending physician, neurologist, rehabilitation nurse, 24-hour service, physiotherapist, occupational therapist, speech and language therapist, dietitian, clinical psychologist. Aside the stroke treatment, we treat other diseases at the Green Hills Medical Center. Call Green Hills Stroke Rehabilitation Center now on 055-2505-108 or 030-3974-818.
So what it means is that when the patient comes to the clinic, the patient should be able to tell you exactly the kind of work he does, which will help you to diagnose. But sometimes people may think that you just want to know the kind of work I do so that you can prescribe a very expensive or you can charge me very, very high. What do you say about that?
Not really. If the facility or the doctors are ethically trained, then that should not be an issue. It's more of what kind of advice we give. So some people have to tell you slow down. Some people have to tell you change. Sometimes we even ask people to change with a positive for backache. Okay, ergonomics. Yeah. So you may have to change the chair. You may have to change the kind of work you do. Footballers, they get certain diseases. They get certain sprain. So when they are young, by the time they get older, so it's all like bankers and certain group of people, they have stressful. So you direct. So sometimes you have to change the work of people. Sometimes you have to take people to slow down.
You change the work of people.
Yes. Sometimes you have to change advice that they should change from a certain environment. Because if you are working in a certain smoke-filled factory, and then they are not using mask, they are not using hand gloves, they are not using sanitation, a lot of those people get certain diseases. So. And the certain disease environment also exposes you to certain things. So it's not only for you, it's only for even the health people to go and find out the environment people are working. There are some countries, they have to close certain factories because they are child labor, they were being abused, they were being abused. You go to the lake, you have child on the lake, or they being abused. So the age and all those things, they are not in isolation. So if a child is in a certain way, if a lady is doing a certain work, if a man is doing a certain work, all of them now work together. Is it fit to do that work?
So that
a driver who is blind, sorry, I wanted to mention this, but a lot of the accidents also because we don't test drivers. They don't see well. So most of them don't see well in the night. But every driver must be tested, it must be obligatory. That we must test drivers. It must be obligatory that alcohol should not be sold near lorry stations. It must be obligatory.
Yeah, but that one, if I'm an alcoholic, where to buy the alcohol will not be a problem to me.
But at least when you are around, while you are going to drive, and you are not there. That's why I probably believe that they don't sell alcohol around certain times and certain places. Not that they don't sell. So all those things are obligatory. You see, drivers have to be tested. That's why DVLA now sees that. Okay. It's mandatory.
Okay. So what it means is that where I work and the kind of work I do affect my health.
Extremely.
So as we graduate from school and we are looking for a job, we shouldn't only think about the salaries and how fat our bank account is going to be, but we should also think about the health implications of where we are going to work, because every work has got its own health hazard. Okay, viewers, I think we have had a very exciting time this evening talking about how certain factors affect our health. Your contact, a number, your next of kin, where you stay, where you work, the kind of work you do, they are very, very essential. So when we go to the hospital, you have to be able to furnish the doctor with all this relevant information. He's not just asking for curiosity's sake or to charge you exorbitant price, but then to help him see what is actually wrong with you so he can help you. Two people may come to the clinic with the same ailment, but coming from different workplaces.
Yeah.
So the diagnosis or the cause of that particular disease may be different, and the treatment may also be different. For one person, it may just be an advice, and the disease will go. For another person, it may be something else. So let's help the doctor to help us. Doctor, take care of your last words.
And so, lifestyle diseases.
Yes.
It's what is killing people now. We are not resting. We are not exercising. We are eating wrongly. It has to do with what we define as success. Work as our success. I think we need to rethink our mind. That success is not health. Actually, success is when you have a healthy body. You are successful only when you have a healthy body. That's my last word. Yes. You are not successful if you don't have a healthy body.
After the resting, thank you very much. But after the resting, we'll take it to the next episode.
Okay.
Because I also asked whether the doctor himself rests.
Yes.
All too soon, viewers, we have come to the end of a very exciting episode once again. Thanks to Dr. Emmanuel Chega for help explain all this importance to us. I believe you have had a wonderful time and you have had a very great education into factors that affect your health. We will come your way another time with a very interesting episode. But before then, take very good care of yourself and lead a very preventive life. And with the coronavirus around, take very good care of yourself by regularly washing your hands and cleaning your hands with sanitizers. Till I come your way again, stay healthy and stay blessed.